This video shows you how to do pre-procedure CT planning using the Redo TAV app. For index TAV is Portico or Navitor, and second TAV is SAPIEN 3 or MyVal. When you click Redo TAV CT planning on the home screen, first you will get the overview of all steps you need to do. The CT acquisition protocol can be the same with routine pre-TAV assessment. It's recommended to obtain an ECG-gated multiphasic function CT that covers the entire cardiac cycle, with ideally 20 phases, a minimum of 10 phases. The mid-diastolic phase generally has fewer artifacts, allowing for better assessment of the processes reflex and commission alignment in most patients. The end systolic or end diastolic phases could be used as alternatives. The first step is index TAV and measurement. If a pre-index TAV CT data is available, select native valve morphology and severity of calcification, and identify your patient index TAV type and size. And then you will get the fundamental information of the valve. Please keep in mind that this light blue eye mark is a link to some detailed information. The reference level of Portico and Navitor is node and commission TAV, hunting from inflow to outflow. The leaflets of Portico and Navitor start at node 1 and end up at the commission TAV. On the next page, select the index TAV failure mechanism and assess commission alignment. Open your patient CT dataset on a CT software. We can use any CT software. We just need 3D MPR, multi-planar reconstruction module. So now we are at the end diastolic phase, 0% cardiac phase. So from here, change to the cardiac phase, to the systolic and diastolic. At mid-diastolic, around 70 to 75, 80, usually is the best cardiac phase with less artifact, and you can see the leaflet as well. And assess commission alignment in the orthogonal view, which refers to the relations between the native aortic valve commissure and THV commissure TAV. The commissure offset is directly measured using an angle tool with the limbs aligned with the native commissure of the RCC and LCC and the THV commissure. In this case, the angle is 36 degrees, so select moderately misaligned, and perform the measurement of area and perimeter. This measurement will be used for second TAV sizing later. We can also understand how much the index TAV is underexpanded at this point. For Portico and Navitor, 4 levels require assessment. Bottom of the commission TAV, node 2, node 1, and 0. Now we are at the bottom of the commission TAV level and measure the area by tracing the center of the stent frame and adjust the tracing if needed, and you get the area and the perimeter. Now move to the node 2. Do the same measurement. And adjust the tracing at the center of the stent frame because of less blooming artifact. And now node 1. Adjust the tracing. And this is the tips to down the window level. Helps you see a stent frame clearly. Lastly, not 0. After or during the measurement, please fill in the area and perimeter in the app. Step 2 is identify your patient coronary risk plan, which is defined as the lowest level of coronaries in relation to the Portico or Navitor reference level. On the CT, we are now at the inflow level, so scroll up the plane, and now you can see the bottom of the RCA. So identify this level in the relation to the node of Portico, which is just at the node 2. And next is LCA. Now you see the bottom of LCA, and this level is also just above the node 2. So select the node 2 for both RCA and LCA. And the app automatically identifies the coronary risk plan. At the step 3, once you select a second tab, you will get an idea about ideal or acceptable level of neoscat plan, NSP, which is defined as the top of the neoscat. For MyVal or SAPIEN 3 in Portico or Navitor, it is multiple levels between the bottom of the commercial tab and node 2. This is because the leaflet nadir of Portico or Navitor start at node 1, so we need to implant at least node 2 to treat the degenerated leaflet. But as you can see here, at this implant position, we admit some significant degree of leaflet overhang. If we implant it higher, like the bottom of commercial tab, it decreases the degree of leaflet overhang, but increases the risk of coronary obstruction. Based on such understanding, you will choose neoscat plan, where you would like to implant. Here is some guide how to proceed from here. We would recommend to assess at all possible neoscat plan and save the summary report for each level. As second tab sizing and coronary risk may change according to the neoscat plan. The lowest neoscat plan, which is node 1 for Portico and Navitor, should be used only for pure aortic agitation, since at this implant position, a second tab will not pin out the index tab leaflet at all. Last but not least, when the reason for Redo TAV is paravalvular leakage, please make sure the second tab will cover the annulus level. So I will start with the bottom of the commercial tab. The neoscat plan at this level will be above the coronary risk plan, both coronaries in this case, so we need further coronary assessment. But remember that a balloon expandable second tab can expand index tab, which means reduce valve to aorta distance, VTA distance, increasing coronary risk. Then we need to determine the second tab size first. Step 5 is in vivo CT sizing. For MyVal or SAPIEN 3 in Portico or Navitor combination, using the average area as the neoscat plane you chose and 2 nodes below is recommended. We already measured the areas and perimeter at step 1. On the app, the 3 levels will be automatically selected, so please make sure the numbers are correct, and if you would like to, check the button of Include Perimeter and click the Calculate. Then you will get calculated average area, perimeter, area derived diameter, perimeter derived diameter. The app cannot suggest sizing at this point, due to the FDA regulation. So you will need to choose the second TAV size based on your CT measurement. Here has some guide how to choose size. And here you can get the IFU table too. For this case, I will choose size 26 SAPIEN 3 and move to coronary risk assessment with the size you chose. As I mentioned, SAPIEN 3 or MyVal is a balloon expandable valve and can expand the index tab further. So we recommend to draw the virtual circle of the size you chose for the second tab and measure VTA distance from the virtual circle or index tab stent frame, whichever outer, and identify the narrowest VTA distance in the dome from the neoscot plane to the coronaries. When the neoscot plane is above the SC junction, please don't forget to assess VT-SCJ. In the app, the relationship between the neoscot plane and each coronary is automatically identified. When the neoscot plane is above RCA or LCA, the next assessment is the relation between the neoscot plane and SC junction. I would recommend to assess RCA and LCA separately and fill in the app. Let's start with the RCA. So first, link the plane to the neoscot plane, the bottom of the commission tab, and assess the SC junction. Now you can see it is above the SC junction, and I draw the partial circle of side 26. And now you can clearly see that the VT-SCJ is 0. And now I scroll down. The VT aortic sinus space is very narrow, so I just skip it and then I measure the VTC distance here. So now partial circle is outer than the index stent frame, so I measure VTC from the partial circle. And in this case, VT-SCJ is 0, which is the narrowest VTA value. The next is LCA assessment. So align the MPR for the LCA and bring the plane to the neoscot plane. Now here, this NSP level is just at the SC junction for LCA size, and VT-SCJ is 0. Scroll down, and then here is the VTC level, and virtual circle is just at the index tab, so measure the VTC from here and get the value. And for LCA, VT-SCJ is also 0. So the narrowest VTA value for both coronary are 0. Therefore, in this case, this implant position bottom of the commission tab is considered as a high risk to coronary, especially sinus restoration. You will get summary reports of 3 pages, which include animation representing the relationship between the neoscot plane and both coronaries. You can take screenshot and also import these reports into CT software summary report, such as 3 So let's also assess the different NSP level. So click this button. Then you will come back to the step 4. Choose neoscot plane. Let's assess node 2. The node 2 neoscot plane will be up below the coronary risk plane, so no need VTA assessment for this neoscot plane. Step 5 is CT sizing. Do the same steps with before. So now you change the neoscot plane to the node 2, so the app automatically selects the node 2 to 0, and you'll get the average area. Now you notice that the average area is smaller than that before. Now within the range for size 23 SAPIEN 3. So I would choose size 23 for this case and at this implant position. So now the neoscot plane and node 2 is below the coronary risk plane. So no need further coronary risk assessment by VTA measurement. And you will get summary reports of 3 pages for this neoscot plane level. If available, the information of pre-indexed TAV CT can be gathered at step 8. This information can help your planning more. Here are the summary reports for all neoscot plane levels. For this case, although the implant at the bottom of commercial TAV is considered as high risk to sinus sequestration, the implant under 2 is considered as low to coronaries. It is also important to note that if a case has severe calcified leaflets, even if we implant SAPIEN 3 at node 2, the leaflets might pin out to the commissure TAV and lead to sinus sequestration. So please also assess the severity of distribution of the leaflet calcification and consider coronary protection if needed. This is all steps for SAPIEN 3 or MyVal in Portico or Navitor combination. I hope this video helped you planning Redo TAV. Thank you.